At 6:51, 1,900 people have been hospitalized across our state, all because of the influenza virus. Dr. Michelle Graham, she's the Chief Medical Officer for United Healthcare of Wisconsin. She's sharing ways to protect yourself and your family. So how has it been with the flu? Is it just rampant right now?
So definitely in the last month or so, we've seen an uptick here, especially in Wisconsin. Across the country, our southern neighbors have had more flu, and now we've definitely seen a rise here with our ERs busier and our hospitals seeing more admissions.
When do I know, okay, I need to go see my doctor? What are the signs that I should do to go?
So the typical flu symptoms are cough, fevers, chills, runny nose, stuffy nose. And when you start having those, it's really important that you notify someone right away. Talk to your healthcare provider right away. So the best protection is the vaccine. But if you're starting to have those symptoms, the possibility of getting an antiviral medication to help decrease the course of the illness or the severity of the illness, you really need to start those medications within 48 hours.
Like Tamiflu, are you talking about?
Exactly.
Okay. And how does that work? How does it shorten it?
So the antiviral medications work against the virus itself, and there are several of them that are available, so it's best to talk to your healthcare provider about which one might be right for you.
Should I still get the flu shot if I haven't yet?
Absolutely. So according to the Center for Disease Control, or the CDC, the absolute best protection that you have still at this time is to get the influenza vaccine.
You know, I'm just so worried about some families who just keep putting it off, and I see some deaths across our country. What could go wrong? Could you get pneumonia or worse, you know, if you keep waiting?
Absolutely. So a lot of people think, like the common cold, that the flu isn't a big deal, but unfortunately the flu, especially in those who may have issues with their immune system already, which may just be from lack of sleep, poor nutrition, not being well hydrated, you can have respiratory illnesses that include pneumonia. Those, especially with underlying medical conditions or chronic conditions, can end up being in the hospital, and ultimately the flu can lead to death, as we've seen across the country.
Who's at more increased risk for this one? I hear younger people, right?
Absolutely. So infants under the age of 6 months are not able to get the vaccine. It's really important for parents, healthcare providers, etc., who may be in contact with them to be vaccinated because they're very vulnerable. They can't get the vaccine. And then anyone who has a chronic illness or already is on medications, the elderly population are at the highest risk.
Okay. Dr. Michelle Graham, Chief Medical Officer of United Healthcare of Wisconsin. Thank you so much for waking up with us. We also have many stories at tmj4.com. Still ahead, we have a lot to cover. We have breaking news for you that we're staying on top of, and meteorologist Josh Worster has a final look outside your door before you head outside.